Hello and welcome. I'm Art Blank, President and CEO of MDI Hospital, and I want to welcome you. This is the fifth in a series of virtual town halls that we're hosting to keep our community informed about COVID-19. As of today, the Maine CDC is reporting 17,311 cases of COVID-19 in our state, 421 here in Hancock County. And Johns Hopkins is reporting 16.8 million cases in the United States and 73.6 million cases worldwide. But before we get started today, I would like to take a moment to say thank you to you, our community of dedicated supporters. As you may know, in January, I made the decision to retire as President and CEO of Mount Desert Island Hospital as of the close of 2020. And when I announced my plans to retire, I didn't really expect the year that was to come. Well, so much has changed this year. My profound appreciation for this outstanding team that I've had the honor to be part of has continued to grow. And I am truly humbled by how this community has come together to address this tragic pandemic. I also would like to recognize our exceptional incoming President and CEO, Chrissy Maguire, and all she has done and will continue to do to address this ongoing global health crisis. I know she'll give great support to this team and care for our community. She's a remarkable and vibrant, passionate leader, and I am confident that Chrissy will utilize her considerable insight and experience to continue to move our organization forward with the utmost skill and compassion for a long time to come. I can't emphasize enough how much I appreciate the hard work, dedication, and commitment of this fantastic team. My 20+ years as president and CEO have been some of the most rewarding and meaningful of my career, and I am so proud of all we've accomplished together. So it's gratifying to know that as I prepare to retire, the future of our hospital is in most capable hands at every level, every day. So thank you, and please join me in welcoming Chrissy to today's virtual town hall event.
Thank you, Art, and welcome everyone. As Art said, I'm Chrissy Maguire, currently serving as your Chief Operating Officer and soon to have very large shoes to fill as the President and CEO of Mount Desert Island Hospital, Birch Bay Retirement Village, and of course, our dedicated health centers. As we reflect back on Art's 20 years of service, his passion, his sense of purpose, his dedication, and endless amounts of energy dedicated to the health and vibrancy of this organization, the community, the state, and even the national healthcare scene. It has been impactful, and we are so appreciative of all of your service. And personally, your guidance, your mentorship, and coaching has been incredibly important to myself, as well as the many other individuals who you have affected throughout your career. We are, of course, very appreciative. And as you can tell today, we will do and take one for the team if we need to. So as we move forward into these new dynamic times, we have a pillar of strength to build upon through our strategies of innovation, of integrated care, and of course, of taking care of this great community with the vigilance and sense of purpose that Art has strategically led us to. So we wish you well. We know you will be taking care of our community and be part of our ongoing work as we move forward in these new times. Today, we are here to discuss the very important topic of mental health and the impact that it has on all of us as we, not only in this pandemic, but in our everyday lives. And during this global pandemic, it certainly has become illuminated as how important it is to have stable access to mental health and behavioral health services. The issue of mental health is critical now, but never more so as we think about not only as we move into a season where we talked yesterday about the lack of light, but also just the isolation that is coming between families, friends, and in general the community. I'm pleased, though, today we're able to have two very skillful participants to help navigate these waters with us today. Dr. Andreas Abreu is the director of our MDI Behavioral Health Center. Dr. Abreu specializes in general psychiatry and oversees MDI Hospital's Penn Medicine Psychiatry program, which brings residents from Penn Medicine to Mount Desert Island and to our hospital and behavioral health center throughout the summer and into the fall to experience and immerse themselves into the rural health setting for behavioral and mental health services. Dr. Julian Kuffler is the medical director of our medical education program at MDI Hospital. Julian has practiced in this community and beyond for over 30 years in family medicine and has dedicated himself to public health as well as the health and vibrancy of this community and patients. He has been instrumental in the last 10 months in leading a COVID-19 task force and response efforts for education, awareness, and the mitigation of this disease. As we work to address the many challenges of the COVID-19 pandemic throughout this community, we are focused on providing as much information and educational opportunities that we can. And we will continue to be your beacon of healthcare information and population health awareness. We would like to take our community very seriously in these efforts, and we will continue to do that through the CDC guidelines for our public health and safety. And as always, these information sessions are recorded and made available to you through our external website, mdihospital.org. As we move through this process, we have in this Zoom platform a Q&A function. It's at the lower bar of your computer screens. Feel free to populate that with any questions that you have regarding the information that we're sharing today around mental health awareness. And we have a moderator, Danielle Silverman, who will be facilitating today's discussion. And of course, if we don't get to your questions, they are important to us. And we will address them as time allows, but we also will make an effort to get them to the right resources to be able to get those responses back to you in a timely manner. So Danny, I'll turn it over to you to start facilitating the questions that we have received in advance and those that'll come through the Q&A.
Great, thank you so much, Chrissy. So while the bulk of today will be about mental health wellness, we do have an update on the vaccination that we are about to receive in our area, and we're hoping that Dr. Kuffler could give us a kind of general update on that and what that means for our community.
Sure. I'm happy to say that as of Monday, hopefully we will receive 300 vaccines of the Moderna. And this is specifically earmarked for the highest risk hospital employees, those who day to day work on the floors where they come in closest contact with people who may or do have COVID. So we have a tiered system that we've worked out. They will begin to receive those vaccines, the vaccinations, hopefully by this time next week, if everything is going according to plan. I think we just have to be aware that Warp Speed has done a phenomenal job over the last year, bringing a number of different novel types of immunizations to the forefront. They've been tested. Currently there are two that, one last week was okayed for emergency use, and hopefully by the end of today, Moderna will also be there. We are receiving the Moderna. And once we have immunized the highest exposure risks. In the hospital, we will go to the next tier of those with exposures. That will probably use a lot of these vaccines. We do know that through the CDC, they are going to be providing the Bar Harbor Fire Department with vaccines, hopefully coming within the next 2 weeks. They will be in charge of vaccinating the EMTs, and within a week or two after that, the fire and police department will receive vaccines. How and when everyone gets their vaccine is still being fine-tuned and debated. As more information comes on who are higher risk, they reserving the right to shift things around. My hope, and most of our hope, is that by the end of January, we will have been able to vaccinate and start vaccinating nursing home residents and the employees there. They really are at as high a risk as any group on this island. As we can see from the history of people who have succumbed to COVID, that is the group we need to protect. Following that, teachers, store clerks, front-facing employees who are at, again, high risk of being exposed to COVID will be next on the list. I wish I could give you an exact time and date for those to happen. It really depends on the whole supply chain. They are ramping this up. We just honestly don't know. The goal and the hope is that by spring to late spring, we will be at the point where seniors who live in the community, starting with those with the higher risk problems, will be vaccinated. It's a fervent hope that come 4th of July, we can celebrate a new type of independence from the fear of the worst parts of the pandemic. That's an optimistic but attainable goal. So I think from my point of view, I want to say that everyone on this island has done an incredible job trying to stay safe. The fact that you're listening to us today means that you are not one of the unfortunate 300,000 people who have succumbed. And that what I want to reinforce throughout today is that what you've been doing has been helpful. Please keep it up. I know it's been a long, tiring battle. It started as a sprint. It's now a marathon, and people are beginning to run out of breath and get frustrated.
Hi, Julian. I'm sorry about that. Were you finished up? My computer kind of froze.
Oh, okay. Sorry. Yes, I am finished.
Okay, great. Thank you. So I think that that's actually a really good segue into a great question for Dr. Abreu. Talking about, could you explain to us like what pandemic fatigue is and what that means, please?
Thanks, Danielle. I just want to thank everyone for joining and for being a participant in this discussion. Hopefully my audio is at an okay level. Okay, I'm getting nods, yes. It's always a pleasure for me to hear Dr. Kuffler speak. I don't know about everyone else because he's eternally optimistic, but it's also incredibly difficult to maintain that optimism in the face of so much adversity. I really cherish my position as a psychiatrist because I'm learning all the time from my patients. And, you know, it's not just that we're dealing with the typical winter blues or depression, but actually we've got a double whammy. And the double whammy is, you know, the normal trials and tribulations that we have living in this latitude so far north in Maine, but also the incredibly challenging circumstances that we've all been living under for the last nearly year. Pandemic fatigue, I think really, when we think about that issue, it's difficult to define. I actually had to do some research about how scientists and researchers think about pandemic fatigue. I think we're all still learning what that means and how it manifests. I think what we can all acknowledge is that whatever we're feeling right now is natural and expected in terms of a reaction to such a sustained and unresolved adversity. Most scientists are kind of conceptualizing pandemic fatigue as a demotivation to follow recommended protective barriers that emerge gradually over time and are affected by a number of emotions or feelings, life experiences, and perceptions and cognitions. I think that's just a fancy way of acknowledging that whatever it is that we're going through manifests as this gradual lack of enthusiasm or energy to do what we know will keep everyone and ourselves safe. And it presents in a variety of ways in both how we feel, how we think, and how we engage with the world. I think when I try to enumerate the three ways that it might present most, or what underlines the ways in which pandemic fatigue presents, the first would be the perceived threat of the virus. And that may diminish as we become more and more accustomed to its existence, even if all the epidemiological data show that risk may in fact be increasing. And I think it's really important to acknowledge what Dr. Kuffler said earlier about the 300,000 or more people who've succumbed to the illness. It's serious, it's still out there, yet at the same time we're having become more acclimated to its presence, and that can lead us to drop our guard or lower our guard. At the same time, you know, the perceived loss resulting from the pandemic response, be it lockdowns, restrictions, mask wearing, that's all likely to increase over time as people experience the long-term personal, social, and potentially economic consequences of those restrictions. That's something that's been felt acutely across the country and the world, and we've not been immune to that. And for many, that balance starts to shift as the pandemic continues to go on longer and longer, and the perceived cost of the response may start to outweigh the perceived risks related to the virus. I think that's a very dangerous economic argument, but it's also something that all of us can empathize with and appreciate. Second, an ingrown urge for self-determination and freedom may grow as restrictions continue for a long time, imposing conveniences in everyday life or continuously change in ways people feel they have little control over. Third, even in the most outrageous circumstances, can become normal when they're experienced over a long period of time. And we can all become accustomed or used to the pandemic and the threat it poses, and complacency can then start to settle in and affect how we're engaging with the world. I think primarily when I think of pandemic fatigue, I think of it as emerging as demotivation to engage in the protective behaviors that keep everyone safe and seek out COVID-related information, all secondary to complacency, alienation, and feelings of hopelessness that I think are very common during this time.
Thank you. So what are some common signs and symptoms for stress that is caused by the pandemic that people might be able to try to recognize within themselves? It's sometimes hard to realize that's going on.
Yeah, and so I'll build a little bit on what I just mentioned, Danielle. You know, I think in some ways this group is self-selecting. The mere fact that we have, last I checked, 60-some participants would suggest to me that you're the very people who are probably extremely resilient, that you're continuing to seek out information about the pandemic, because one of the things that can start to settle in is a diminishment in the amount of engagement around information gathering related to the pandemic, being informed about the pandemic, understanding the risks related to COVID-19. And that's one of the ways that we can start to identify a sign of pandemic fatigue within ourselves and others. Previously effective messaging about the importance of hand hygiene, wearing a face mask, practicing proper physical distancing. We can see that take place in ourselves and in others, and that is also a manifestation or symptom of pandemic fatigue. Again, this is all natural. All of us are going through this for the first time, and the ability to kind of tap into our surge capacity becomes more and more limited as this goes on. Hopefully that's helpful, Danielle.
Yes, yes, it is. So if someone is feeling like they're in a crisis, in what way can they get immediate help? Like, what are some things that you would recommend?
Sure. So hopefully Danielle's going to put some numbers up. But certainly if anyone at any time is ever feeling like they're in a crisis and would benefit from speaking to someone emergently, the number that I provide to just about most people I run into on a day-to-day basis is the main crisis line. And the number is 1-888-568-1112. Sometimes things don't rise to the level of a crisis, and it's just an overwhelming need to kind of reach out and speak to someone. And there is something called the intentional warm line, and Danielle's going to also hopefully flash that number in the chat box. And that's a good resource for when there are those times where you feel like you need to speak to someone, but it's not to the level of a crisis. Of course, I also recommend to my patients that they should be reaching out for help whenever they feel the need, and I encourage them to reach out to their primary care practices, schedule appointments when need be, or reach out for a referral here at the Behavioral Health Center in Bar Harbor by calling our number at 288-8604.
Great, thank you. And Art, what are some resources that we have to offer here at MDI Hospital and Health Centers for someone who's in a crisis? Can they talk to like their primary care physician or other people involved in here?
One of the reasons that I came to this hospital was because of the emphasis that's placed on the treatment of mental and behavioral disorders, the importance of overall wellness, not just physical, but psychological. And so certainly the Behavioral Health Center is a center of expertise in treating mental and behavioral disorders, and we remain available to the community. But sometimes it's hard to establish care for a variety of reasons. And your primary care practice, your medical home is an excellent resource. There are physicians, nurse practitioners, and physician assistants who are well-versed in the treatments of the wide range of mental disorders that we can experience throughout our lifespans. They also have access to case managers, care managers who are trained in short-term supportive counseling and solutions-based psychotherapy. And those are integrated right into the primary care practices, and those resources would be available to patients of those primary care centers.
Thank you, Dr. Abreu. And I can only add that one of the best ways in which we work to serve the community is through the relationships that each of our community members have the opportunity to build with the primary care system. And as he noted, while the team at each of our health centers is led by a physician who certainly is one of the resources that our community has. The reason we build the kinds of team approach to care that we have is because of the variety of skill sets that can be offered and the variety of needs that our patients have. And I would encourage everyone to make sure that they've developed that relationship with their primary care team, because this is a great example of something that no one in their right mind would have predicted was going to descend on us in the way that it has. And it's these times when those relationships are most helpful.
And if I could just add one more thought to that, Danielle, you know, the other really wonderful thing about this hospital is that we're all connected with one another. And I often get you know, questions from primary care doctors and others about, you know, how to think about the treatment of mental illness. You know, is it, you know, be it depression or anxiety? And I want everyone to know that, you know, if ever there's a time where you want a psychiatrist's opinion, you can always ask your primary care practitioner to reach out to me and have them pick my brain, so that you know that I'm in the background offering help if you want it through your primary care practice. And that's something that we're trying to champion here at MDI Hospital, a more collaborative care model when it comes to the treatment of psychiatric disorders. And that is something that we're just in the very beginning stages of trying to roll out.
Great, thank you. We actually just had a question come in through the Q&A box, and I did want to remind our attendees today that you can ask questions during this live broadcast. At the bottom of your screen, there is a Q&A feature. Please feel welcome to use that, and we will do our best to get to all questions during this event. Again, if we don't, we will try to follow up with you via email afterwards. But the question that just came through was someone is seeking suggestions to handle some anger and frustration towards people who are not properly social distancing and not making really good decisions and choosing to go on vacations and so on and so forth. Do you have any recommendations?
I may not have very good ones, but I'll try. You know, when I think about this issue, you know, we're all going to be affected by this. So there's a part of the brain called the insula, and that's going to light up bright hot when we see something in the environment that seems wrong. And there's a lot of opportunity for that right now, because there are certain restrictions that we had hoped that everyone would be implementing all the time. But even with our best efforts, even the best of us can slip up. Now, what I think might be helpful is always trying to lean into the positive reinforcement whenever possible. So rather than seeing what doesn't look right or isn't up to the standards that we would hope based on the CDC guidelines, that we congratulate and encourage people when we do see people doing the right thing, rather than just looking for those opportunities when people may not be following the CDC guidelines. So I try to do that whenever possible, thanking people for wearing a mask, for making sure that they're appropriately distanced from me when I speak to them or meet with them, and that, you know, I speak out loud and I articulate the ways that I'm trying to keep themselves and myself safe when we're in contact with one another.
Great, thank you, Dr. Abreu.
Just to add one thing, that if you see someone without a mask and they don't look at that point in time mad and angry, I carry an extra mask, and I ask them if it seems appropriate, particularly if they're coming close to me. Did you forget your mask? Would you mind wearing a mask? I would be happy to interact, talk with you if you have a mask. And if they say no, you say thank you very much, and then you fall back to a safe distance and just leave it alone. Just consider they're having as stressful a day as the rest of us. Their coping mechanisms may be stretched beyond their control. So I've never found that confrontation gets us anywhere, but offering of support, offering some positive interaction. If it doesn't work, smile and move on.
And Julian, just to build on that, we've implemented that within our own organization internally. We realize that everyone needs a gentle, friendly reminder, and we are giving our team tools to do that, and giving them and empowering with that opportunity to say, I'm not gonna, you don't have your mask on. I'll wait for you to put that on before I come into your office. Just cues, so you help with that muscle memory and behavior change of addressing that. And we've been very successful with trying to just reinforce that behavior internally as well. People forget, and that's okay. It's just, again, those gentle reminders and collegial coaching and kindness that we feel is making a difference for adherence to those prevention methods.
And I'd like to just also chip in, because I do think everything that's been said talks about positive reinforcement and being a community. And I do believe that modeling the kinds of safe behaviors that, for the most part, our community has modeled is the best encouragement for others to participate.
I could pipe in once more in that, you know, the island, Mount Desert Island, was noticed through the summer as being one of the more safer places to be. By middle of July, to late July, there were more people wearing masks than not wearing masks. There were lots of signs saying, you're into a busy area, please wear a mask. It's pretty amazing how well that worked. And it was positive peer pressure. I also think on the flip side is that if you, at this point in time, are going into a store where there are people who don't have masks on, you have two choices. One, you can just decide, I'm not going to be here. Or you can ask for the manager and say, you know, I feel so much safer when I'm in a business where people are wearing a mask. Will you please do what you can do to help that happen? Both of those, managers tend to respond, and the community tends to respond in a positive way. Thanks.
Great. Thank you, Dr. Kuffler. So I actually have another question for you. For people who are in assisted living care and nursing homes, what are some ways that they can, because they've been pretty isolated during this whole pandemic, unfortunately, and what are some ways that they can kind of cope during this time?
Sure. Depending on the level of the significant family member who's in the nursing home, if their eyesight is still good, I would flood them with photographs, with things that remind them of the people who know and love them, of scenes that they're aware of. A nursing home room that's full of pictures, photographs, scenes of family and places they've enjoyed is just so much more of an inviting environment. If you have ways to communicate them, if they can still use a phone, I would get on a regular phone calling so that they can look forward to hearing from you. Sometimes it's nice to surprise them. Sometimes it's nice to say, when would you like me to call? And then if they say 4 in the afternoon, go out of your way to try to make that happen. Or have someone they know as well call at that time. So it becomes a group activity. Something for them to look forward to is a great way to get you through a day. Getting them music, things to listen to that they used to really enjoy, which takes them out of the present, gives them permission to be in the past, is also another really nice gift, actually, to those folks.
Thank you. And now kind of on the other end of that spectrum, how can we help children cope? Because this is also a very confusing and stressful time for them as well. Do you have any recommendations?
You know, the more you can get kids talking, the better. There's a good chance that you are going to hear what are the issues that they're concerned about if you can give them license to talk about their fears, worries, and anxieties. If you notice that one of your children is becoming much more angry, their fuse is as short as yours is these days, then it's worth pointing that out, helping them see that they're not alone, and being kind of transparent about one's own fears and worries and concerns, both for themselves and for the rest of their family. It's an opening that kids can talk about their fears and worries. I think when a child gets a chance to talk about their fears and worries and share it with someone that they know and trust, that is really supportive. It may be frustrating to listen to it and listen to it over and over, but let them know that you're there, you're listening, you care. That transparency goes a long, long way. And also, if you run out of thoughts and directions and ways, head toward your primary care provider, see what sort of resources are there. They can, we work as a team at this hospital. We can get Dr. Abreu and those folks at the Behavioral Health Center involved. You don't have to be alone. Your kiddos don't have to be alone.
I could just observe, because in discussions with some of our clinicians, they talk a lot about the fact that structure is so important for children, and this pandemic and the impacts of it has disrupted structure in a variety of ways, different ways for different people. So I want to ask if there's ways that parents can create new structures so that there's some more predictability in the child's daytime routine. Would that be helpful?
I think that could be very helpful. I also think that just finding time and asking kids whether you can do something with them. What is it that they would really like to be able to be doing? And share the reality of what are the limitations. But there's nothing in this book that says you and your kids can't get outside. There's no such thing as bad weather. We just have to put on the right clothes and spend some time. Offer to make that very regular. If you like to throw a ball, that's great. If you want to walk in the woods, let their imagination go free and wild, that's great. Keep them talking, keep them focused on what's around them as well as what's going on inside of them.
Very timely observation about the book.
Great, thank you. Dr. Abreu, this has also been a very difficult time for healthcare workers. It's been a very long and trying year. What are some coping methods for stress among healthcare workers and other essential workers that you would recommend for them?
Thanks, Danielle. So, there is a specific peer support line that is available for healthcare workers, EMS, and others, the main frontline warm line. And I think Danielle included a link to that number in the chat. The number is 207-221-8196. This is a line that was set up by the Maine Association of Psychiatric Physicians, relies on the volunteerism of psychiatrists, psychologists, social workers, professional counselors, and others who are available 12 hours a day, taking calls from anyone who feels like they're in need of support. Certainly, healthcare workers are not immune to the effects of the pandemic or burnout or anxiety or depression. And sometimes getting support from a peer anonymously can be very helpful. And that's what that line is there to do. I think, you know, we do a great job of this, I think, at the clinic and the hospital at large, but peer supervision, going to colleagues and talking through difficult experiences can be very, very useful. And it's something that I'm a big proponent of. That's something that we do here at the clinic. I, of course, want others in the healing arts to think about whether or not they have the supervision that they need, because that's so critical to staving off burnout and anxiety and depression and so many other ailments. So I think those would be the two recommendations I have.
Great, thank you. And Dr. Kuffler, do you have anything that you would want to add to that that might be helpful for healthcare workers and essential workers?
If I find the mute button, it works. I think that healthcare workers need to realize that they're not alone with the stresses. I actually looked up the latest statistics on workforce mental health problems, and of physicians, 50% of them say they experience inappropriate anger, tearfulness, and anxiety. Now that's significant. And I think that if you are feeling those, they also talk about as much as 8% actually have thoughts of self-harm. So if you find yourself having those thoughts and feelings in your healthcare field, one, realize you're not alone, and two, that, as Dr. Abreu said, there really are folks that are willing to reach out and listen. They just have to be contacted. In terms of nurses, 73% of them saying they have challenges with sleep problems. 50% say that at times they feel just overwhelmed. And 30% of them have feelings of depression. So if you have any of those feelings, first thing is to realize they're real, they're significant, but you're not alone. And I think that if we start to recognize that we are not so unique, that we can't work together and acknowledge the problems we're all having, and we'll find a lot more support there than we realized. Thanks.
Great, thank you. So a question just had come in, it's actually vaccination related, so I'd like to direct that to you. It says, with regards to the vaccine, is there an accurate antibody test to determine if you already have the antibodies and maybe do not need the vaccine? Or is the vaccine recommended regardless of possible previous infection?
Okay, they're great questions. There are antibody tests that are available. The question really comes down to, what do you do with the information? Some of these antibodies are not terribly specific, and we really don't have enough data to be able to tell from a good antibody test whether that is a sufficient level to protect you from an reinfection. So it's going to be a while until we have, one, really good test, and two, we have a good reference. We do know that people who have been infected have been reinfected. So it's not a sure bet. Many of the people who get reinfected, it's more mild, but you can't bank on that. I think that as vaccines become available, they have not seen any signs that being vaccinated, having had the infection, will cause any harm. It's only going to stimulate a very specific reaction and strengthen your immune system.
Great, thank you.
And Julian, just to build on that, from what Dr. Krevins, who's our infection control specialist, he actually said, has referenced that they're getting the vaccination is the priority, and the antibody testing is really not supported at this time through CDC science. So, you know, to your point, Julian, the real focus here is to move towards vaccinations, and then after that, then we focus on what the right type of antibody testing would be in the future.
Correct. We're going for herd immunity through vaccinations, not through potential deadly infections.
Great, thank you. And Art, this was kind of a follow-up to the other question. Additionally, what besides practicing safe COVID practices, is there anything that the general public can do to help support healthcare workers and frontline workers during this time?
I think far and away the most important things are to be safe. The best thing that anyone can do for a healthcare worker is relieve them of the pressure of having to deal with 1 or 2 or 4 or 8 more COVID cases. But in addition to that, recognize that I can't speak highly enough about the team I've been working with. So, and I mentioned that earlier. But this is a group of people that really have been on guard and vigilant for going into our 10th month now of this pandemic. And just recognizing that the disruption that has affected everyone in their lives over the last 10 months. And the disruptions are different for different people, depending on your work, depending on whether you have children in school. There's all kinds of different ways in which this virus has impacted virtually everybody in their home and in their life. And just an acknowledgement, if that's helpful, depending on this, again, the circumstances of your interaction with the healthcare worker, that they've had that added stress. And we work very hard to provide an environment here that's supportive of that stress, but they're an important part of our community. And we really appreciate, and again, I'll go back to there's an appreciation, a sincere appreciation on the part of our team to the level of evident support that we do get from our community.
Great, thank you, Art. Now we are kind of starting to get towards the end time, and I wanted to touch base on seasonal affective disorder, because I'm watching the sun go down outside right now, and it's not even 4 o'clock yet. And I was hoping, Dr. Abreu, if you could kind of give a quick recap of like what seasonal affective disorder is, and what are some good solutions for it during this time of year.
Sure, thanks, Danielle. Yeah, so we're losing daylight every day up until the solstice, and it's very common for individuals living in areas this far north to experience some seasonal affective symptoms. I think we can just use the term seasonal depression. Typically, it's a depression that most has a seasonal pattern. There are other types of mood disorders that can have a seasonal pattern, but almost nearly all the time, it's typically going to be depression. And so really the symptoms of seasonal affective disorder, seasonal depression, are the same that you would experience in a depression. So that would be low mood, loss of pleasure or interest, increased appetite, increased weight, sleep disturbance. That could be too much sleep or too little sleep, fatigue or loss of energy, poor concentration, a feeling of heaviness or slowness, feelings of guilt or feelings of worthlessness, and then thoughts of self-harm or suicide. And now what makes the seasonal depression unique is that a person would experience the onset of those depressive symptoms at a certain time in the calendar year. When we think about this part of the country where we live, typically an individual would start to experience those kinds of symptoms sometime in the fall. Most frequently, it's right around the change in clock with daylight savings time. Additionally, there's going to be resolution of those depression symptoms with the change in season. So it could be that an individual would experience depression for fall and winter, but then with the onset of spring, or maybe later into the summer, that there'd be a complete resolution of those very symptoms that I mentioned previously. In order to make a full diagnosis of seasonal depression, typically there would need to be 2 depressive episodes in 2 consecutive years that began at a certain time of year and resolved at a certain time of year, speaking seasonally. But a lot of people experience kind of what we consider to be kind of a subclinical or subsyndromal seasonal depression. So it might not be that an individual experiences many of the symptoms that I mentioned, but experiences some of them. So it could be that maybe appetite increases, feelings of fatigue or low energy increase, there's diminished motivation, and maybe that's it. And that wouldn't be enough to really qualify for what we think about in psychiatry as a depressive episode, but they're certainly significant, and sometimes they can impact functioning maybe to just a small degree, but sufficient to be bothersome to the individual who has those symptoms. And so that is kind of seasonal depression in a nutshell. And then I think Danielle was pulling a fast one on me and wanted me to also talk about what you can do about it. And Danielle, if you want me to, I'm happy to proceed there. I'm happy to take a pause and just elicit feedback from you or others.
Yes, yeah, I actually, thank you. I was thinking maybe we could discuss the bright light therapy there.
Sure.
Yeah.
Yeah, so when we think about seasonal affective disorder, seasonal depression, about 1 in 10 to 1 in 20 patients in a primary care practice are going to have these types of symptoms. There are some really easy things that can be tried to treat the seasonal depression. One of them, as Danielle mentioned, is bright light therapy. What we've come to learn is that probably there's something very complex that occurs through the retina and in the central nervous system that has to do with light and circadian rhythms. The mechanism hasn't totally been worked out, so there are lots of different ideas about what exactly the mechanism is, but that hasn't been fully elucidated. But bright light is a really inexpensive intervention. It's very effective for treatment of seasonal depression and depression generally. What it involves is using a bright light box that has fluorescent bulbs within it emitting white light. And there's a certain intensity of light measured by lux, L-U-X. And one would use a bright light box that has 10,000 lux capacity. You would be near the light box, not looking directly at it, but just having it within the periphery of one's view for about 30 minutes every morning. The duration is important, the timing is important, and the distance of the light box from the individual's eyes is also important, and that varies from product to product. I think Danielle is going to list a few reputable light boxes, which are the 3 that I recommend to patients who do struggle with seasonal depression symptoms. And there's one manufactured by Carex Health Brands. There's another by Alaska Northern Lights, and there's another by the Sunbox Company. They range in price, but they're all very good. And price really shouldn't be the barrier. Just go with whatever feels comfortable in terms of those 3 reputable brands. There are other things that can be done for seasonal depression, but that would be kind of the easiest intervention that I can think of that's been demonstrated to be highly effective. And this is something that you could easily talk about with your primary care practitioner, and they would be able to answer more questions.
Great, thank you, Dr. Abreu. So I think that actually is, we're getting out of time, so I wanted to turn it back over to Art for some final words, please.
Okay, well, thank you. Thank you, Danielle. And I want to thank all of you for joining us, and especially I want to thank our panelists for devoting this time to support the education of our community, which is one of MDI Hospital's prime efforts in continuing to help support the safety of our community, as well as the integrity of our local healthcare system. But as you know, as I talked about before, and I can't emphasize enough, we can't do this without you. We need your vigilance, your support. We need your awareness of one another and what another's needs are. And we also need your support and awareness of the need for better testing, better treatments, and for widespread acceptance of vaccines. So although the incidence of COVID-19 remains very low in our community, we must continue to be hypervigilant with our precautions. So until a vaccine is widely available, wearing a mask or a face covering, practicing physical distance and hand washing, avoiding crowded situations with poor ventilation, and avoiding travel continue to be the best things that we can do to protect ourselves and our community. So thank you again so much for joining us today and for our ongoing commitment together to our community. We consider the health and well-being of our patients, our community, our staff, and our staffs to be our #1 priority. And we appreciate your participation in this event, as well as other activities focused on our community safety. So thank you again so much for joining us, and have a great day.
Thank you. Thank you, everyone.